There are about 500,000 people in the United Kingdom who are eligible for surgery for their obesity. And using standard figures, you can work out that that would cost about £9 billion to undertake the initial surgical procedure. But of course there would then be other additional costs later after surgery in relation to giving supplements and screening them at intervals, particularly if they'd had a gastric bypass. The medication you've been using has been dramatically reduced.
It has, yeah.
Now what about walking though? Are you able to walk further and faster now?
Yeah.
And do you get short of breath still? It's always difficult to know what would happen to somebody who's very heavy. They're quite likely to develop high blood pressure, may well develop diabetes, and both of those conditions of course will increase their risk of heart disease, so they may well eventually have a heart attack and a stroke.
Yes.
It's a journey.
Yeah.
The way I decide on the type of operation is based on the patient's wishes and also what I think is the best option for this patient. So if a patient has got, let's say, type 2 diabetes and is extremely obese, then this patient may be better off having a gastric bypass.
If patients can reduce weight prior to surgery, it makes a significant difference both for the anaesthetic and for the surgeons. And from a practical point of view, intubating patients when they've lost weight is much easier. Patients are more able to walk to the theatre and mobilise and position themselves on an operating table. It makes the procedure much easier and therefore much safer.
Tina actually achieved a weight loss before surgery, which is the same as is usually achieved by individuals who've actually had surgery. So she managed to achieve a very good weight loss with no surgery.
There is a case for saving money on the NHS, having done bariatric surgery. The money actually is returned within 2 years, not 3, because of the less number of GP visits, less prescriptions for diabetes, hypertension, back pain, and also these patients then become active members of the society and are able to take up employment, which they could not do previously.
I found out after the operation how hungry my head is, but my stomach's not really hungry. It's a lot to do with my head. I eat off a saucer and I know my limits, and if I do go over my limits then I feel a lot of discomfort. When I was big, I used to dread thinking of going away on holiday, especially on a plane, because my greatest fear was not being able to fit into the seat on the plane, or being embarrassed asking for an extension. Apart from being depressed, going out was a big issue. But now, since all the weight loss and the operation, everything's on up. I'm excited about going out. I used to hide away when I was really big. When photos were taken, I was always hiding behind people. Now I want to show myself to everyone. I'm happy with how I look now.